Hello and welcome everybody to Alion's Joy. Today I am very happy to see you. Thank you for joining. We have a great show today. I want to share some information with you about trauma-informed care, something that is very near to my heart and dear to my heart. And it's a serious topic, so we'll have definitely a lot to share that is of some serious information for you, but to apply it in your work, hopefully, and something that is today more important than ever before, because we all have a lot of things that around us that cause anxiety and that bring back trauma, that bring back pain, that brings back hurt, or that puts us in a situation of fear or angst. And today I want to share something with you that I do at my work and that I have really shared with a lot of people around me at conventions and public speaking places, because I wanted everybody to be a little bit more aware of what it did for me and how important it was for my patients. How important it was for me to work with my patients with this trauma-informed care. So today I want to share a little bit about what that is and what I did with it. As you know, most of it, my trauma-informed care work, comes back into my work with patients as a life coach, clients as a life coach in my practice, and it comes very much back in my work as a trauma-informed yoga teacher. And in my work, I do that a lot. And I work with patients at an addiction facility, in-house, inpatient, long-term recovery, right? And if you work with people like that, it is very, very, very obvious that there are a lot of benefits to trauma-informed care, working with patients in a different way than just all, let's go and stand on our head. So what are some of these benefits and what it really is and what it does for people in your class or for your students? I want to share that with you today. So there is a lot of benefits to it, but we're slowly coming to what it really is and understanding why it is so imperative right now in our society. I always say our mission is just to empower patients, right? If we work with clients, students, or patients in a certain facility, it is to empower them. And especially at my work, in my setting of work, it is very important to help patients with PTSD or patients with trauma. And if you are somebody who works as a coach, as a wellness counselor, as a fitness coach, maybe, or as a yoga teacher, maybe, with students and with clients and patients that are definitely suffering from trauma or suffering from PTSD, then you know that this is the show for you today. And it gives you hopefully some information. And hopefully I can share with you what I did with that, right? As joyful as Alion's joy usually is, it brings me joy to know this and to be able to share this and to be able to share it with my patients and to be able to share this with you today, this information. So what do we really do? Our mission is to empower patients to be able to heal with the practice of breathing, with the practice of mindfulness, with the practice of yoga, beside the normal and the usually conventional therapy that patients are already receiving with their therapist or with their counselors, right? So if you are in a setting like mine, in my work, then I work with patients that are going to talk to their counselors, they're working with their therapist, they're working with their counselors on anything and all the issues that are coming back from the past with their trauma and with their PTSD. So we have to process and progress and work through those that pain, that harm, that grief, right, that we all experience. But an additional complementary practice could be that trauma-informed care when it comes to the body. Our biggest spokesperson and the person that brought this all to life is Bessel van der Kolk with his book, The Body Keeps Score. And that was actually a little bit of an eye-opener for people because we didn't really think so much of the implications. We didn't really think through or work with our bodies. We didn't think about the implications that we have if we are PTSD or trauma survivors, that this all has a huge impact on our body. And so, what we call nowadays the somatic approach, what I do as a somatic approach practitioner, I look at my patients and I see that they might be suffering from a lot of stress that has manifested itself in the body. I talk about that a lot, right? And if we see that, I can see my patients holding stress or pain in their body that is actually related to PTSD or to their trauma. We want to have everything, all the outcome that we want, what our vision is really in our work, and for me in my work, is that I want to eliminate life-threatening behaviors with patients, right? So I want to eliminate and help them eliminate self-harm and definitely physical risk behaviors, maybe suicide intent, maybe those behaviors that are really physically very, very grave, right? They have a lot of implications there. I also want to reduce therapy interfering behavior. So that has all to do with the things of negative thinking and self-esteem that are constantly putting us on a path of procrastination, failure to follow through, failure to comply, or just failure to take direction in general. And that's why sometimes, as a counselor, therapist, we have fallout from our patients because they're going back into that negative thinking and into that thinking of, well, it never works out for me. So, I'll just don't go anymore because it doesn't do anything. I can't do it. It won't do anything for me. And ultimately, I want to reduce the quality of life interfering behaviors, right? And that is just really that big thing that we're working with, like ultimately eating disorder. You might have addiction behavior, right? And so that might be overspending, that might be gambling, and that might be overeating, like I said, that might be a sex addiction, that might be what I work with my patients in a case of alcohol or drugs or opioids, just over addictive behavior, overuse of. Very dangerous, of course. And I want to help interfere that quality of life behavior because what it does to your body and what it does to your thinking is just not very healthy. We're thinking about healthy outcome, right? So one of the things that we definitely want to look at is that we know that we always see urgency as a trauma response. We always see the immediate need, the need to heal, the immediate need to get there already if we are experiencing an episode, if we are experiencing trauma coming back, right? If we're experiencing pain, if we are experiencing something from the past constantly haunting us, if we have negative thoughts constantly interfering with our daily life, if we are fearful, if we have a lot of anxiety, if we're feeling depressed, all that leads to the fact that we want initiative, we want to take immediate uh, uh, initiative to healing, right? And we have to, that urgent feeling of let's take a pill or maybe the alcohol helps. And that is not always the case. So we want to go back to understanding that it might take a little bit longer, but that the benefits are definitely, definitely there if we work another way. There is some core principles to trauma informed work, to trauma informed care, to trauma informed yoga. Something that I do has to do with understanding trauma and stress, right? That in the first place, we have to come to an understanding of somebody that is in a totally different place than maybe I am. Somebody, I need to meet people, I need to meet my patients where they're at in life regarding their age, regarding their lifestyle, regarding the complicated events and happenings that they have been through, and the now, the moments, the minutes, and the situation that they're in. I need to meet them there and understand that that is a situation, a deep and a grave situation for them. And then I have to approach that with compassion and with a sense of dependability, a sense of the fact that I can understand and have compassion for that. I don't have to take it home, but I understand a lot of different situations because maybe I've been there. In my case, I've been through a lot myself, and I've been in some of those situations where I have a full understanding for my patient or my clients and what they're going through in a moment. And I also have to create some dependability and a sense of working together where they find that trust in me to work with me. I also have to embed and make and have a sense of transforming and trying to get my patient to be into accept long-term recovery and to be in a sense of resilience. I always say, you know what you did 200 years ago? You just got back on your horse, right? And although it is way more difficult in our society, in our current culture, and in all the environmental stress that we're dealing with, it's a different way. We are not sitting in our house on the prairie, and we are not just getting on a horse. Our situations are different nowadays, but we have to understand that we have to create some inner resilience and tap back into that strength that I always talk about. Tap back into that strength that we realize that we used to have. Very important. One of the other principles of understanding is that we are trying to empower somebody and give them their power back, which has been taken away by a traumatic event or by an event that caused PTSD long term. Your power has been taken away. And so I try to help you, empower you, and bring that back, right? And we also have to create a safe and a very stable environment. So in my case, for instance, that means if I work with my patients, that I create a soft, warm, safe, constant, the same environment as they always find when they come to me or when they come to my yoga studio, when they come to the Zen Den, right? They always find the same atmosphere. And that is something that creates that safety and that trust. If we're going back to where I started working, for instance, in a medical or in a clinical facility, we deal a lot still with the implications of self-harm, with the implications of drinking, with the implications of alcoholism, drugs, and in a physical detox phase, there's not much that I can do. But after a detox phase, when somebody is in a treatment facility, after the detox phase, when I start working with my patients, I can create that environment for them to let them understand or make them understand that talk therapy or that just therapy does not have to do the trick only, and that I can be a great addition to their healing. And why is that so? Because again, then I understand and then I explain, or then I make them understand and explain that everything they've been through is also very visible in their body. Long term, it leads to chronic pain. All that we hold inside, all that we're thinking about, all that we're dealing with, all that we're survivors of, might sometimes still settle in our body, and we haven't been able to let that go. And what do we now do in that holistic healing program? As a supplemental program, as an additional program to conventional DBT or CBT treatment, what we do is bringing a little bit more of a feeling of a holistic interpretation of what can you do body-wise, right? How can you heal your body? And how can you, as I lightly say that sometimes in a lot of different circumstances, if it's just coming to anxiety or having a moment of not being able to get up and do what you need to do, put your sexy back on, put your body back on. In trauma and in PTSD cases, working with my patients, it goes deeper. It takes sometimes a lot of time to understand that when you come to a safe and trustworthy environment, in a warm environment, that it's still very difficult to trust your body again, or maybe to understand that you're holding a lot of pain there, or maybe to understand that you can actually work through that, but that it's work and that it doesn't instantly deliver that yes, I'm going to call the doctor and take a pill moment, right? It doesn't deliver that instant gratification, but over long time, you can always understand better your anxiety and your depression. You understand better where you're coming from when you have chronic pain and what you can do for it and where it might be coming from. So a gradual integration can be transformational for my patients or for my PTSD survivors or for survivors, for instance, of physical assault, right? Rape victims, all that. When it comes back to me, I try to get people back in touch with their physical being and feeling safe in their own place, feeling safe in their own body. So we have an opportunity for survivors, for trauma survivors, to go slowly into a mode of finding peace and healing through breathing techniques, through meditation practice. I bring a lot of different forms of meditation. We talked about that, I think, the last couple of weeks, and did shows on that before. So there's a lot to work there with my patients and with my clients, and also through yoga. And I understand that that is not an easy thing to do, and I'm going to give you an example of that. What happened to me years ago, I was teaching a yoga program that I wrote all over the country at different wellness and fitness conventions. And actually, I was teaching my yoga program to yoga instructors and yoga teachers. And I thought at that moment that a lot of people were not well informed about this. So that program was about trauma-informed care and how to teach. And I had a lot of yoga instructors in the room, over 50, big room full, big hotel room full of very excited yoga teachers, instructors, yoga influencers, right? People that are doing and teaching yoga and making that their life. But a lot of things that we haven't thought about at that moment, that we didn't think about at that moment, and that I was trying to teach and trying to tell them, was that we didn't think about at what level do our clients come in or practice in your yoga studio. And that we sometimes have to be a little bit more careful with certain yoga poses, just introducing certain poses to my clientele. At that moment, I also had a normal, or average, a regular yoga studio, and a lot of yoga enthusiasts. People came in, right? Yoga enthusiasts. So in that modus, I understood that not everybody was always ready to just open their legs in a wide open angle position, or maybe pull their knees up in a butterfly position, and not being able to maybe to even lay on the floor for a long time, just in a very soft savasana pose, what we call a corpse pose in yoga, right? Savasana, just relaxing your whole body with your legs slightly tumbled open, and your feet tumble open a little bit. There was a lot of positions, even a down dog position, or a forwards fold position could be very intimidating for a student or a client, because we didn't think about the fact that these clients, that my clients at that moment maybe was thrown back into an experience that had caused them trauma. It was a physical experience. It was maybe an assault, a physical experience that was long-term um, um, thought of as being healed, or as being worked through, or as being processed, but it might come back in a class setting like that. So we talked a lot about that in that convention setting, because a lot of instructors said, gosh, I never thought about that. And nowadays it comes back a lot more, because we are trying to do with yoga a lot more healing practice, a lot more helping people with anxiety, helping people with trauma, helping people with PTSD. So I see it a lot more around me. So a lot of things is that. So again, we try to establish a connection with our own body for our patients, to trust ourselves and to strengthen our inner self, right? And to strengthen the connection that we have with our physical self. So we want to make our body a stable and a safe place. And we want to build skills for coping strategies, right? For managing painful experiences. We want to have also a little bit of a build into a strong community with peers or with people around them or with people around our patients, people that are there, and build that safety and that trust again, also in others. So it's all about self-acceptance, trusting ourselves, and also being able to start trusting others in our environment again. So that's really, really a big thing. And what I have done with that in the program, in my program, and I have been so blessed to be able to work at a treatment facility where people allow me to do that mind, body, spirit work, right? So it's the mind and the spirit has been lost. A lot of AA is about just believing and knowing that the connection with your higher power will help you heal and will help you in recovery and in long-term recovery from addiction. Working with your therapist and with your counselors works and helps so much in different treatment modalities will help you so much to learn to talk about it and to express your feelings and to talk about what had happened in the past. But now, as a third modality, as something that comes additional to that, don't forget the body, because the body was keeping score of what you had been through, right? So, trauma has so many physical effects. And this is only something that we know the last decades, the last couple of decades. It has so many physical effects that you might experience a lot of pain, a lot of physical pain, and you never knew that all that chronic pain, all that lower back pain, or that intestinal pain was also instigated originally by your thinking, by your pain, by your trauma that you were holding on to. So, beyond talking, this is an additional healing method. And sometimes we say, and this is quoting Bessel van der Kolk, it is great to be able to put your feelings into words and to understand that, and to share that suffering was big and huge, and that to be able to talk about it is enormously comforting. But it doesn't make your body necessarily know that you're safe. Talking about it doesn't make your body know that you're safe. For you, it's comfort, right? That you can express your emotions and express your feelings and become better and better in verbalizing your pain. But it doesn't make your body understand necessarily that you're safe. And so the real method on top of that is also resetting your physiology, resetting the connection that you had with your inner self, with your body. So that is really, really important to understand that and to understand that an individual's experience of trauma impacts every area of human functioning. So not just mental, emotional, behavioral, social, spiritual, but also physical, right? Trauma is a somatic reaction. It is a somatic reaction. So what are some of these symptoms, for instance, that we can recognize in trauma or PTSD survivors? There's a lot of things that are out of people's control, and we can daily see that in people. So we all have that. I even have that if I just experience light stress. I call that light stress because it might something that comes in during my day and goes away during that same day, right? But I was stressed about it. I was worried about it. So I have dysregulated breathing or sometimes really constricted breathing. And my throat locks up. So I have also throat constriction. I have an inability to express myself. I have a lack of presence. I am not really feeling in the moment. I just can't feel it. I just constantly worry about the past or worry about the future or are in a really, really bad situation where I cannot just have an attitude of gratitude. I cannot be in the now. I feel nervous. I feel tensed. I feel confused. I have an irritation, an agitation, a constant feel of being on the edge. I feel nervous and tensed. And I have also maybe even GI issues, right? Or I just can't go, or just feel that I'm really, really bloated all the time. I might have sweaty palms. even profuse sweating all over my body. Even if you're a sweater, then even some more, just in a very, very cool or regulated situation. And I have heart palpitations, increased heart rates. I have anxiety really setting in, and all these physical symptoms of that anxiety. My thinking is, what if, right? Constantly, what if? My monkey mind goes, but the physical symptoms, right? That sweaty palms and that full sweat and that breathing. I have flashbacks and nightmares. I experience low energy levels. I can't sleep sometimes. I have heightened sensations. That means that you're really sensitive to everything. And you feel, you hear, your skin's crawling all the time. You might, this is my number one, because I always see that. That's why I can say to my patients, I can see where you hold your stress. The number one is always this, right? A lot of stress in the shoulders and in the neck, and a lot of stress here in the jaw as well. And so we feel also that we have a sunken heart and we have a heavy heart, a lot of aches and pains. So all these things are all the common symptoms of trauma survivors and people with PTSD that you can help in your practice. So it's very important to understand that you can help. And we can help through trauma. We can definitely help people that are sometimes able to go and start talking about their pain, but also the people that are not there yet because they feel that constriction. They're not able to bring it into words yet. So what we can do in our practice with meditation and with yoga and with breathing techniques is very important. So I will give you a lot more breathing techniques to work with over the next couple of weeks. And I will talk about some poses, definitely in yoga, that might be helpful for exactly that. So we talked a little bit about the core principles of creating the trauma-informed culture, the safety, the trustworthy, the fact that we are collaborating and that I want to empower you, that there is definitely a grow factor. And I see that already after 3 or 4 weeks, sometimes working with my patients. So regarding the nature of the event, regarding the nature of the PTSD or the trauma, we can help doing that body work. So starting with your breath, just a couple of techniques, really simple, that I did a lot and I still do with my patients a lot. It's just a breathing visualization, right? Just looking at something and breathing through it. Just trying to visualize a really nice warm beach that you're laying down on, and you just listen to your breath and relax your body. Sometimes we can do a little mindful breathing where we actually start following our breath all the way to our toes and combine that with a body scan, just relaxing your body one little part at a time. And sometimes we can just simply count. I do that a lot with you. In 4, hold 4 counts, exhale 4 counts, and hold 4 counts. That is one of the basic principles that I start with my patients with trauma-informed care. Just breathing and feeling a little bit more empowered, feeling in control of what you can do, how your body feels, and how you can get your body back, how you can feel that you can get that strength back, how you can feel empowered by being in control about more of the physical symptoms that are caused by PTSD or anxiety. There's a lot more to this. So there's a lot more that we can do in the classroom. There's a lot more that we can do as yoga teachers, as yoga instructors. It's a lot more that we can do to create an environment of compassion and understanding, and that we can help empower you. I hope that you will reach out to me, of course, if you have any questions or stay after today's show. There's so much more to it. I don't even have the time to go into a lot more techniques and a lot more fun things that we can do together. But what I do want to tell you today is that please reach out to me if you have questions, or stay after today's show. Y'all stay today to discuss this and to get a little feel for what we talked about today. I want to know if you understand, and if you understand what I talked about today, and if you have experience with this, working somatically, working with your body, working physically through pain and understanding what we can do with this mindfulness, with this meditation, breathing, with yoga, or with just very, very simple yoga based movements, right? We don't even have to do yoga. It's another time for another show because a lot of people are intimidated by just that. And I get patients of all sizes and of all places, right? So we just want to make sure that somebody is feeling safe by doing just a very, very simple thing for their body. So thank you so much. Namaste. Thank you so much for watching today. Stay afterwards or watch me on YouTube, watch me on Win Win Women TV, and stay with us because it's going to be awesome. It's going to be fabulous. And you are fabulous. Thank you so much for watching today.